Drivers, hey, I want to welcome you back, coast to coast, border to border, in the U.S. and Canada. Nice to have you on board. Yeah, I'm going to keep it on the medical issue, or the medical front. For this segment, Dr. Fahmi Farah is on board with us now, and we're going to talk about summer exercising. And I did want to touch real briefly on May being Mental Health Awareness Month. And, Doctor, thank you very much for joining me on the program to talk about this. Just had somebody on a few minutes ago from NYU Langone Medical in New York City, and we were talking about the fact that that May is Mental Health Awareness Month. A lot of things going under that with depression, anxiety, sleeplessness, and things like that. And when you combine all of that together, if somebody's depressed or a lot of anxiety, that's like a toxic cocktail for the hearts, right? All of that adds up, doesn't it? Take its toll on the cardio system. Welcome back.
Hey, great to be on your show. Absolutely. I think any kind of mental health issues, depression, anxiety, all of that can take a big toll on your heart health.
Yeah, and the ways that people try to maybe fix some of this is the standpoint that they may try to self-medicate. That would mean things like maybe drinking or drug use. If they resort to other means to try and resolve all of that, that additionally takes a big toll on the heart, right? When there's self-medication going on.
It does. Substance abuse, smoking and drinking, all of that can be very detrimental for your heart health. It can accelerate a lot of different types of heart diseases like coronary artery disease, blockage, heart attack, heart failure. So all of those can be very bad.
Okay, very good. Thank you for kind of breaking that down for us. With the summer coming, we're going to switch gears. Summer coming, and a lot of people are going to be out and about, exercising, walking, running, jogging, playing golf, or whatever. But this is the time of the year that more of the exercise gurus or enthusiasts like to get out there and do what they like to do. So when you talk to somebody about maybe the importance of exercising for the heart, keeping it healthy, any sort of recommendation as far as what would be heart healthy for an exercise program? Before you begin any exercise program, talk with your doctor about that. Maybe there's something you can't do at this stage in life, right?
Yes, it always that. Exercise programs should be individualized for each person, depending on how healthy they are and how used to exercising they are. But exercising is recommended for across the board, everybody. It is one of the healthy things you can do that is good for the heart. So I encourage everyone to actually exercise, and those who are risk factors or existing heart conditions, they should run it by their physicians to have a more tailored exercise program for them.
All right, and many might think, doctor, and be the guide on this, that when they're exercising, they want to get that heart really pumping fast. I mean, getting that thing to beat like there's no tomorrow. So what are your thoughts on that? I mean, is it super critical that when you're exercising that you really accelerate the heart rate? Does that show, okay, maybe the heart's doing its job? Or if you're accelerating the beating of that heart, so with that exercise, can there be limits as to what the heart can maybe accomplish with like exercise and things?
Yeah, the acceleration of heart rate is one of the components for, having a healthy heart down the road. And how high your heart rate should get, that part really needs to be individualized based on the current health condition of that individual and what other conditions they have.
Okay, yeah, absolutely. And, thinking along the lines, I knew somebody a long time ago. I lost contact with them over the years, but they had atrial fibrillation. And when they would go exercise at a local gymnasium in my part of the world, I noticed when they were on the cycling bike, that their heart rate had jumped to like 175. And I was thinking, well, okay, that seems a little too high. Was that common? I know this person had AFib, and maybe that might be another story right there. But if your heart rate is getting up to that range of like 175 or 80 during exercising, is that a good thing or a bad thing in your estimation?
especially if it's like high intensity exercise, it can get up to that range, 170, 180. How safe is it like down is depending on, again, like the age of that patient and what cardiac conditions or risk factors they may have. You mentioned an important condition called atrial fibrillation. That is a very common type of arrhythmia where the heart tends to go out of rhythm and it just beats irregularly. And people who have that, they can have very high heart rate from time to time, especially during exercise. So those people, they really do need to run it by their cardiologist and go with their guidance as to how fast is it for them to go safely.
Okay, very good. And a lot of the drivers that are out there listening, that they're going to be on the road and they'll park their rig at night, maybe at a truck stop or in a warehousing area and try to get some rest. And thinking maybe some that might have some maybe heart conditions when they're in the truck, they're laying down on the mattress, but it seems like their heart just doesn't slow down appropriately. Can the heart just keep beating at a really, really fast pace, even if you're at maybe if you're in a situation where you're laying down? What do you do in that case if you can't get the heart rate to slow down when you're laying down, as an example?
Yeah, for certain, for people with certain conditions, for example, as you mentioned, atrial fibrillation, right. Even at rest, as you mentioned, even as they're laying down, their heart rate can go up. And not just atrial fibrillation, there are various types of arrhythmia where that can happen. So there's several things they can do. For one type, for example, SVT is one common type of arrhythmia known as supraventricular tachycardia. A lot of people have that, and when they sometimes even at rest while laying down, their heart rate can go really high. So what we recommend to our patients generally is like try to do some non-medicinal things to slow down the heart rate. Like, if you're anxious, calm down, try to remove the stressors. Try to do some Valsalva type maneuvers to like slow down the heart rate. Sometimes when you do that, like Valsalva maneuver, increase your vagal tone, and that can help slow down that heart rate. And then, of course, if it doesn't go down, the recommendation generally is to seek help. If you're having symptoms with that of shortness of breath, dizzy spells, you should seek help and go to the emergency department.
All right, very good. All right, doctor, let's do this. We got to do the commercial break, and Dr. Fahmi Farah is on board. Ladies and gentlemen, one of North America's best-known cardiologists. And if you want to chat with her directly, I've got some lines open. She's not here to diagnose you over the phone, obviously, but how to give you that little extra nudge, that extra little spark, if you will, to get yourself into the doctor and get checked out. I'm all about, helping you with the medical information as well. So let me ask you this, drivers. When you lay down at night in that bunk, is your heart just running a race? Is it just going and going and going and doesn't slow down to a normal pace? Let's get your stories. And many have said, well, they like to exercise before they go to bed. We'll talk about that as well. When we come back, Dr. Fahmi Farah on the line. Stay tuned. More straight ahead for you. SiriusXM 146. Hey, drivers. I want to welcome you back. And Dr. Fahmi Farah is with me, and we are both in the Dallas-Fort Worth area. Doctor, hope you have your umbrella. You're probably getting a lot of rain like I am now over the Dallas area. Nice to have you on with us. And let's get your website out there and social media and phone numbers and all that. Where can folks find you?
You can find me at www.drfahmifarah.com. Also on social media at Fahmi J. Farah.
One of the questions I had earlier last week, this was right after that you were on with us, and it was really a great question. I'm going to pull it back up here from a gentleman by the name of Jeff. And here it is. Let me read it to you verbatim. Mark, I appreciate the fact you've got Dr. Fahmi Farah on talking about heart-related issues. He said, quoting, "My problem is that I've got some heart problems, but I don't have the insurance to be able to pay for any kind of a treatment." And I wanted to put that out there and get your thoughts on that in a situation where somebody definitely needs some kind of heart awareness or helping maybe take care of the heart, can maybe that patient come to you or others and say, are there clinical trials available? Would a clinical trial situation maybe benefit that an individual, maybe with no insurance?
There are certain situations where, yes, there are some trials available, but for the most part, in the cardiac world, most of the conditions and the treatments are pretty well defined, and in a majority of the cases, we do have treatment available where they don't necessarily have to be enrolled in a study to get that particular treatment. So for a patient to need a treatment through a trial is actually pretty rare in the world of cardiology.
Okay, and that's going to be exciting, though, from your vantage point, right? Because it sounds like some really great strides have been made in the arena of cardio care, heart care, as compared like with maybe 5 or 10 years ago, right? Some great strides being made in that arena.
Oh, well, absolutely, yes. Cardiology is one of the well-studied fields within medicine, and there's ongoing research going on. Many more advancements are coming. It's a very high-technology field, and we're very grateful for that.
Yeah, and a lot of the research that you've been part of has been groundbreaking research, which has really got to be quite satisfying, correct? And maybe getting involved with other physicians or generating research independently on your own as an example, right? Where do you find the ideas to do the research on, the new maybe situations develop with heart care that warrant a lot of research? The education process sounds like it's ongoing, always on the go with new research, right?
It is. It's always ongoing. And the reason for the new ideas is, of course, we're constantly trying to improve this field. It's with two different focuses. One is to improve survival while reducing things like heart attack, and the other is to improve quality of life. And yes, those ideas come from everyday patients that we see and constantly striving to improve the field and improve patient care when it comes to cardiac care.
And Doc, you mentioned this before, that if somebody is experiencing maybe a heart distress, could be in the truck, could be in the grocery store, wherever it may be, somebody might go down. And time is really of the essence with this, correct in that? Because I think the average response time for medical ambulance service is going to be about 3 to 4 minutes, maybe a little bit better, maybe a little bit longer, obviously. But that time difference can really make a tremendous difference in saving the life of that patient. Is that why, and you mentioned it before, it's so important to learn the CPR, or if there are defibrillators maybe in the side of a building on the wall, learn how to do all that stuff, right, to help somebody survive.
Yes, I totally agree with that. When it comes to a heart attack and especially cardiac arrest, time is of the essence. The sooner a patient gets CPR in this scenario, the better chance of survival. And not just survival, also like not having comorbidities and not having neurological deficits.
When you mention comorbidity, what is that? What is that exactly? Comorbidity?
Sure. So when somebody has a cardiac arrest, the first concern is to bring them back to life. But then the second concern, once they revive, how functional will they be? Because one of the biggest things that happens when the circulatory system stops is that blood flows up to the brain. And brain doesn't handle that very well, so there could be brain damage if the CPR was not initiated in a timely manner. And so that's like a time when we start that CPR is so essential because we want the patient not just to survive, but to survive well and not have any neurological deficits.
All right, my golly, Doctor, drive safe. I know you're in the Dallas-Fort Worth area with me. A lot of rain coming down, and thank you very much for joining me on the show. Got to get ready to wrap it up. That is Dr. Fahmi Farah on the line with us, and we'll do it again next week. Always great to have her on board.